Honors Final Project, Health Inequity, America's Chronic Condition, a speech analysis by Amanda Hernandez for Honors Public Speaking, Professor David Gower. Childbirth should be a time of new beginnings, but according to the Centers for Disease Control, this is not true for Black women more than any other ethnic group in this country. Dr. Esteban Lopez says Black women have a 3 to 4 times higher likelihood of having what's called a negative birth outcome that may include premature infant, low or lower birth weight infant, or their child dying from what is called all-cause infant mortality. This quote is from the speech I will be analyzing today. This speech was given by Dr. Esteban Lopez in 2017, and its primary focus is on health inequities for Black families in America. I will conduct my analysis using the methodology of Neo-Aristotelian criticism. This criticism fits best because I'm able to use each of the 3 appeals to prove the effectiveness of the speaker. My sources on Neo-Aristotelian criticism come from professors in the communication field and are as follows. Professor J.A. Hendricks maintains that Neo-Aristotelian criticism is useful not just in breaking down the subject at a historical and judicial level at hand, but further it holds value for utilization to see the bigger picture of whatever is being analyzed. Professor Gerald Phillips describes Neo-Aristotelian criticism as a form that is multi-applicable to any and all subjects for analysis. And Professor Judy Siegel crowns Neo-Aristotelian criticism as the default methodology form which most medical professionals are trained in and that those in medicine make the most use of, and it is used in both speech or written work presentations. I will use the appeals of ethos, pathos, logos to present the proofs for why Dr. Lopez was an effective speaker with his presentation. His goals were met. He wanted to use his speech to inform and to provoke feelings of connection and hope. For ethos, he speaks from a position of credibility. Pathos, he uses sentimentality as a means of carrying a lot of emotional weight to the way that he speaks, and in use of visual aids as he provides in his PowerPoint. For logos, the doctor makes statements on health and equity issues and provides proof for both the problems and the solutions. Ethos, the speaker's character. So who Dr. Lopez is really important because it determines whether his experience make his arguments credible. For this speech, then in the link online for the video, there is a long description of just who Dr. Esteban Lopez is. He's dual board certified in internal and pediatric medicine. He's award-winning in his achievements in his career. And he has over 12 years of experience practicing in the San Antonio Metropolitan Health System, which is very populated. So when Dr. Lopez says in his speech, as a pediatric doctor and as a parent, I know far too well the stress, the heartache, and fear associated with having a premature infant, his words carry value because he does really know. Dr. Lopez is an effective speaker on the subject of Black maternal fetal medicine inequalities because of all of his experience and expertise. So his human interconnection, pathos, emotional appeals used to provoke a reaction. Dr. Lopez is very good at pulling heartstrings and making sure the listeners feel something about the content he's presenting. The doctor uses photos of real persons, a personal friend and their child, to make the statistics not just abstract, but real human beings, people that resemble perhaps those that the audience may know also. The statistics that he displays and have these stark, unequal burdens of inequality and suffering are posted to his PowerPoint, yes, but he's using them as a way to get them to consider the information and its seriousness. He takes on a serious tone of voice, and he also pauses and asks the listener to think about what he is showing and what he is talking about. He also uses humor to connect to the audience. He gets the audience to laugh from the very start of his presentation by making a quote from the fictional Hunger Games movie about the odds being in someone's favor of survival. Everyone laughs, but then he immediately cuts to the chase and he gets right into the unequal access of medicine and how in this country that means people don't survive. The odds are not in their favor, and this is real life. Another joke that he makes includes laughing at the innocence of a child who survived a health disparity for the population he's speaking of. A Black woman was his mother, he was born premature, and he is basically everything in those statistics, but he has them laugh at the innocence of this child because that's something everyone can relate to, a child giving their parent a hard time, and it's really well placed and well used. Again, he gets the audience to laugh about releasing stress, and he talks about, oh, it's really stressful this week because in 2017, at the time this speech was given, it was in Congress and the Senate that people were fighting to revoke access to expanding healthcare affordability. And he's capitalizing on the emotions of the listener if they too are stressed out about this, and to think about how much he's using this biofeedback calming mechanism, and he gets them to really participate in the speech. He asks them to inhale and exhale, and so not just does he get them to laugh, but he also gets them to participate. So he is very, very good at using and making a case for being credible through pathos. Logos, arguments effectively proven. He appeals to logic, right? What does the science say? What are the facts? He uses his experience as a physician, and he uses all the facts that show the evidence of these inequities that he's speaking about. He's able to effectively prove the existence of Black inequities in childbirth for families with peer-reviewed scientific medical journals and the data and statistics and testing that are all that he needs to back up his statements. He shows Black women are experiencing these inequities at alarmingly higher rates. They experience higher levels of stress on account of racial bias, and then further proves that this is not because they are Black and it is something in their inherent genetic disposition. He proves this with a journal from the epidemiological study on Black immigrant mothers and their children. So when Black women in their home country gave birth in their country of origin, they had higher levels of average weight and thriving weighted babies, and they were overall majority healthy, as opposed to when these same women came to America. He says in one generation, their daughters have birth outcomes that are equal to the general African American population. And that's terrible because it's very unequal as compared to the rest of the population, as is shown by the CDC. And I'll just briefly go back, and you can see the huge difference by race compared to the rest of the race and ethnicities in America. And we'll just move on to implications. So what now? What are the implications of this presentation? Dr. Lopez effectively argues for the need of greater awareness. These racial bias problems in medicine only exist because of systemic dehumanization of Black families, their entire ethnic groups based only on the color of their skin. People in medicine need to take it personally. The population at large and the greater medical community need to be made more aware of the terribly stark realities, both in death toll and long-term suffering facing Black families. As Dr. Lopez says in this speech, we have to treat patients in a culturally competent manner and recognize that racial bias affects their health. But if we don't recognize it, we don't know it's there. Racism in medicine, especially against the most marginally affected in the Black community, is a problem that will not go away unless enough people take it seriously and care. Even those not in medicine need to take it personally. Raising awareness, voting for policies and representatives, getting involved in one's own community, making sure to hold those in power as well as those who care directly for these vulnerable populations, making sure they're held accountable. And these are just a few examples that Dr. Lopez brings up to help reverse the course of violence of racism in medicine. Conclusions. My conclusions are honed by my own experience as a medic for 12 years in the Houston medical system. My patients are the reason I chose this speech. Dr. Lopez, to me, is an example of a fellow Hispanic medical provider who cares to be a voice for those he serves while prioritizing who is being most affected currently. And I hope to join him one day in being a voice in the medical community for the suffering witness in order to help change things. I will preface this with a warning of discussion of stillbirth and basically explicitly describing what the reality of consequences of systemic racism look like for Black women and families that I have witnessed. I currently serve a very specific population. I transfer children. They're some of the most sick children I have ever seen in my life. And they live on ventilators, machines, they have medicine pumps, and the only way they can leave the house is with me by ambulance and their nurse. They have to have a whole team with them to keep them stable just to get from the hospital to their doctor's appointments, to wherever they need to go for therapies. So I've had instances where these very fragile patients, something as simple as spit up that a normally functioning child would just need a pat on the back to correct. These children can literally deteriorate so fast that it requires that we go lights and sirens 911, and we have to make a decision if we're going to the ER. And I've had mothers crying in the back that they're worried about being able to afford to keep their child alive. And they're worried about that affordability all because this child was born in that population, in that high-risk population with that negative birth outcome that led to them being in this moment where a mother is worried about even being able to afford to keep their family alive. So that is something no one deserves. Another instance about the infant mortality and maternal mortality specifically, I witnessed a Black mother coming into the ER. She's in labor. She gives birth. The baby's stillborn. We tried everything we can to revive them. Did not happen. And weeks later, the mother died of the same infection that took her child's life. So part of my conclusion is this, that if we had more caring providers like Dr. Lopez focusing on preventing the complications of racism and healthcare accessibility, so many more lives could be saved and suffering could be prevented. Would that mother and her infant have survived, not been stillborn? Would families no longer have to worry about being afforded to keep their child alive? I really think so. So for all the darkness and despair, there's hope. Hope that if more people do more and take direct actions, racial bias can be mitigated and eradicated. Dr. Lopez says, health inequities are not an impossible solution. In this speech, he effectively gives hope that if more people do something, the more lives can be saved, the more we can do things to reverse the course of racial bias in medicine. You shouldn't have to see it with your own eyes to understand and want to do something. And Dr. Lopez effectively shows that it's possible to connect the issue at hand with the populations at large with the power of a well-given speech. With more voices and actors in and out of the field of medicine, we can really see a hope for reformation and change. Everyone deserves equal access to care. Dr. Lopez closes his speech saying, because in doing so, we allow them, Black families, the freedom and liberty to lead the lives they want to live.